Hello, my name's Madeline. Thank you so much for reviewing my application. I first started seriously exploring OT by doing informational interviews. So I pretty much reached out to anyone and everyone I could find who practiced OT, and I learned a ton during that experience. I learned that OTs can work in so many different settings. I met people that worked in skilled nursing facilities, schools, hospitals, psychiatric facilities. And I also learned that OTs can work with so many different populations, which I thought was really cool. I met people that worked with the elderly, worked with children, people with disabilities. So that really solidified my desire to pursue OT as a career. So then I looked for shadowing opportunities to really get a sense of, what OT looks like in the field. I ended up shadowing at a brain and spinal cord injury unit. I worked at a hand and upper extremity rehab facility, and then also I worked in equine therapy. So all of those were like really different, really cool experiences. I would say the main through line was just, helping people live more fulfilling lives through meaningful activity. So like one patient had a hand injury, and we focused on strengthening his hand, reducing pain, stretching, and all of those things so that he could get back to his passion, which was rock climbing. And another patient was paralyzed, living in a wheelchair, and we helped him learn to successfully, independently transfer himself from his chair to his bed using a transfer board. So just things like that really solidified my commitment to OT. Just, seeing the difference that it makes in patients' lives was extremely inspiring. I think having a sense of belonging is extremely important to living a fulfilling life. In the context of OT, I think that, having an injury and being in that recovery process can be extremely isolating because you can't do the activities you used to be able to do. And so you just, feel sort of alone. Or, if you have a disability and you might not be able to do some of the things that society values, that can also really damage your sense of belonging. So I think that OT can help in that, it can help you, A, learn to be able to do some of those activities, and B, just sort of validate your lived experience, and give you a sense of confidence, a sense of independence, that can really, give you a sense of belonging that you maybe wouldn't have had otherwise. An example of that would be at Mount Sinai, I observed a dance troupe for people with wheelchairs, and it was so much fun, like just seeing people having smiles on their faces the whole time, laughing, and just being so grateful for that community. It really reinforced my belief that, a sense of belonging is just so important to happiness. I think that OT has the potential to contribute to advocacy for disabled communities. I think that OT can do a really good job at reducing stigma by just, normalizing different ways of living and different skills and different like benchmarks for success. So like one person's goal in therapy could be to be able to tie their shoe more efficiently, while another person's goal in therapy could be completely different, like they want to get back to playing their favorite instrument again. So I think that, OT's emphasis on individuals' goals can be really beneficial for just like advocacy for different levels of ability. I think that also OT can contribute to people with disabilities like independence a lot through the use and like normalization of adaptive equipment. So, for example, in one of my shadowing experiences, a woman had really severe tremors, and it made it hard to eat and, write and things like that. So we had her do stretches before eating, and also wear weighted wrist weights, sorry. And, use a weighted adaptive spoon that has like a nice big handle. And it really improved her ability to eat and to write and things like that. So, I think that OT can really creatively address different issues for people with physical and cognitive disabilities.